Welcome back to Better Living. I'm here with Mike Coulter. He is a physical therapist from PT Link Physical Therapy. We're going to talk about some of the great things they do there. We were just discussing cupping. It became very popular during, or everybody knew about it, I guess, during the Olympics, thanks to Michael Phelps and his big red circles all over. Yeah. We all kind of learned about it. You guys do cupping in your facility.
We have great results with it.
And it kind of breaks up your muscle, right? Is that...
Yeah, it helps to relieve pain. You know, the cupping is a vacuum system that actually pulls the tissue up and creates a vacuum, increasing blood flow to the area. So it decreases pain, decreases muscle spasm, helps improve the environment for healing.
That does sound like all good things. It does hurt a little bit, I understand. Just a little?
Just a little,
just
yeah.
For a second?
Not too bad, yeah.
Well, maybe my son is just telling me that, so I'll feel some sympathy for him when he has it done.
That's probably exactly
I think
right.
That's it. It doesn't really hurt him.
Yeah, no.
Okay, so the other thing that you guys do a lot of is this dry needling. I know nothing about it. Tell me what dry needling is.
Yeah, dry needling is based on our modern understanding of anatomy and physiology and how the body works between the circulatory system and the muscular system and the nerves and the joints, and how it all combines together when you have an injury or any tissue that's pathological. So what we do is we take a very thin filament needle. Here, I'll show you here. And I don't know if you can
yeah, that's tiny.
Even see this or not.
Hold it up there. Mikey can try and get a shot of it, but it is, boy, you
can
barely,
I'll move it around here a little bit in front of my shirt. You can see it a little better.
Yeah, it is so thin.
Yeah, it's super thin. What we do is we insert these into the pathological or the painful tissue and into the deeper tissue, into the muscle and the joints. And what that does is that increases circulation to the area more than anything. So what happens when you have damaged tissue or chronic inflammation or an injured area, the tissue actually contracts a little bit, like you heard a muscle spasm. So the muscles get tighter, they get spasmy. You have adhesions that form because capillaries or small blood vessels are broken and everything kind of sticks together. The circulation brings scar tissue into the area, little fibers that are laid down all over the place. All that stuff causes a blockage in circulation and normal circulation. So we're not getting the normal blood flow to the area. So what the needling does is it ends up going in and it inhibits or blocks that little signal that goes between our spinal cord and our brain to the low back or the neck or the foot or wherever we're needling, and it decreases that pain and decreases that muscle spasm. And it also increases blood flow into the area. And by increasing blood flow, it literally helps our body to have a better environment to heal itself, and it speeds recovery from injuries or any type of overuse problem or anything that's going on that's causing pain.
And what we're watching here is on someone's back, so clearly you can do that like in a bigger area like your lower back, but can you do it like I had ankle surgery, and so my left ankle it's just still painful. I mean, it was 4 years ago, but it's still painful. That joint's painful. You can do it on a smaller area like that too?
Yeah, so obviously in your ankle, you must still have some type of chronic inflammation in there. So we use needling in the ankle. We use it throughout any area that has had surgery. We use it in the, probably more than anything in the neck and the low back. People that, are in sitting jobs that have problems all the way. All the way to problems where people are bent over working all day. We do the bottom of the foot, plantar fasciitis, Achilles tendonitis in the back of the heel. We do a lot of dry needling for headaches, shoulder problems, tennis elbow, knee problems, all throughout the body.
Okay, so I ask about the pain and the cupping. The wimp in me wants to know, is it gonna hurt?
You know what? It really doesn't feel bad at all. I mean, most people don't really feel anything. Occasionally you might feel a little sting, but more than likely people are, I'll already have 4 or 5 needles into somebody, into an area. Like, did you put them in yet? Yeah, well, yeah, they're already there. I didn't even feel it. So it's amazing.
I actually can believe you because I saw that needle and it's so tiny that I can see where you wouldn't even, you wouldn't feel it at all. So how many treatments would I need to have before I feel some relief?
Yeah, it really depends on the person, and what's actually going on. Remember, we're trying to induce biochemical and mechanical changes within the tissue, like we talked about. So, instead of using drugs. So if we can do that over a few treatments, it's very beneficial if you think of it that way. Sometimes people feel, we only need to do one, and sometimes it's many times, but, it just varies on the person and what's really going on with you.
Well, the body is a great healer if you let it heal itself. And sometimes when we start popping those pills, it inhibits it from healing itself.
Yep, exactly.
So where are you guys located? How can I come and see you for this dry needling treatment?
We are PT Link Physical Therapy. We're all over the city and the surrounding area. So, we have one of our main locations is right behind Chick-fil-A by the mall, Talmadge, in the old PNC Bank building. So we're on the first floor in there. And we're in Oregon. We have physical therapy at St. James Club, where we have aquatics also. But in all of our locations, we do cupping, we do needling. We're at Miracle Mile across from Kroger. Yeah.
So
great convenient locations.
You have a website we can check out to find all of those locations?
Yeah, ptlinktherapy.com.
All right, and all we need to do is call and make that appointment.
Just call and make an appointment, yeah. And the great thing about dry needling is it's covered under your insurance benefits for physical therapy. So
fantastic.
Yeah, we have awesome results. It's been the best thing that we've added to our list of tools.
Great relief. Can definitely help you with that pain. Give them a call today and or check out their website. Get to one of their many locations. We'll be right back.
Thank you.